Hello, my name is Erica Lewis, and I'm going to argue why the social stigma surrounding midwifery in the United States is not justified. But first, I'm going to give you a small introduction onto what midwifery is. A midwife is a trained professional who helps healthy women during labor, delivery, and after birth of their babies. Some typical tasks from WebMD you can expect from midwives are the following: prenatal exams, test ordering, family planning, physical and psychological monitoring, birth planning, diet, exercise, medicine, and health planning, pregnancy, childbirth, and newborn care counseling, emotional and practical support, baby delivery, and lastly, doctor referrals if necessary. The different type of midwives are certified nurse midwives, and certified professional midwives. Certified nurse midwives are the only type of midwives that are permitted in all the U.S. states due to the fact that they are registered nurses. All three types of midwives have to pass a national exam. Certified nurse midwives and certified midwives have to graduate from an accredited nurse midwifery education program. Certified midwives have to have a bachelor's degree in the health field, while certified professional midwives have to get training and clinical experience. There is a lot of social stigma surrounding midwifery because many obstetricians argue that midwives do not have all the training necessary to help deliver babies. They also argue that giving birth is so dangerous that only a highly trained medical professional has the ability to protect the mother and child during the birthing process. The social stigma surrounding midwifery is not justified because midwives have the skills necessary to assist mothers with low-risk births, and obstetricians are known for medically intervening when it is not always necessary. Home births are safe for low-risk pregnancies. If complications arise, midwives can transfer their patients to a specialist or emergency care. Midwives provide extensive attention and support during and after birth. With their expert knowledge, they are able to provide mothers with supportive techniques and effective birthing positions. For mothers who want a more natural birth, midwives use non-pharmaceutical comfort measures and have less medical interventions. Mothers are also able to form more emotional bonds with midwives. In the study by Katie Kajimanel and others, 66% of women who chose to have a midwife did so because they wanted a woman to deliver their babies. Mothers also like the idea of an assigned provider. Her study also found that there was a lower chance of communication problems with midwives compared to other providers, with 40% lower odds of midwives using medical words that were hard to understand, not spending enough time with mothers, and not encouraging mothers to speak all their concerns. Only 14% of women with midwives held back questions, which is low compared to the 25% of women with other care providers. Now moving on to obstetricians. Although obstetric interventions may be life-saving when judicially applied, their routine administration when they are not medically indicated can be associated with increased risk, increased difficulty in postpartum recovery, and decreased maternal satisfaction with birth. Some common unnecessary medical interventions from obstetricians are induced labor, continuous electronic fetal monitoring, premature rupture of membranes, and elective C-sections. These interventions have negative impacts on the mother. For example, the increase in maternal and neonatal morbidity has been linked to the increase of elective C-section, and mothers have a higher risk of infections. The babies will also have a higher risk of asthma, type 1 diabetes, and gastrointestinal disease. In conclusion, mothers should be able to choose the conditions which they want to have their baby, without the burden that comes with social stigma, because there are advantages and disadvantages to every birthing option. The following are the sources that I used to create this video.
created using Powtoon.